What we showed is that obviously there is baseline difference between patient who undergo surgery or TAVI. Probably the patient who had TAVI were at baseline older and sicker than the one who undergot surgery. But after propensity matching, the two cohorts were comparable in terms of baseline characteristics. And what we saw mostly is that after around 1 year, we had 2 times more likelihood of death following TAVIs and surgery in this particular cohort of patients with bicuspid aortic valve. And when we analyze another composite outcomes of myocardial infarction, stroke, heart failure, and death, we showed again that TAVI was associated with higher composite outcome probability compared to surgery.
This content is copyrighted by Mayo Foundation for Medical Education and Research.